Good afternoon. As always, it's nice to be with you. Today, we're going to walk through our typical numbers, share with you what the status is of our COVID-19 data across the state, talk to you a little bit about this upcoming holiday Labor Day and what we can do to really keep going with the gains that we've made, share a little bit of news about our data reporting system, and then spend the bulk of our time talking about our new blueprint for a safer economy, where we know there'll be a number of questions from the press at the end. So to begin, I want to invite up my colleague, our acting state public health officer, Dr. Erica Pond, to walk through parts of the presentation with you. And it's a real privilege to have her. Her dedication over many weeks has been tremendous, and really leading the way, working with all of our county leaders and other public health officials across the state. So it's a real privilege to invite Dr. Pond to share some time with you as well.
Good afternoon. Thank you very much, Dr. Ghaly. It's wonderful to be with all of you this afternoon. So I will start with overall trends in case numbers and hospitalizations. I'm happy to share that we continue to see down trends in both cases and hospitalizations. So new cases for today, we have 3,712. Our 7-day average is 49.57, and that decrease over the last week has been negative 14%. Of hospitalizations, 3849 hospitalizations today of COVID patients, and that is down 29 from yesterday. Our weekly trend on that is down by 24%. We have 1,194 patients in the ICU in California right now, and that is down by 29 compared to yesterday as well. And that weekly decrease is also by 25%. So again, we're really seeing some encouraging trends there that we hope to continue. As far as testing, we can tell you that about 97,000 tests were conducted as our daily average recently, and our 1-day testing positivity is 4.9%, and our 7-day average is 5.3%. We have 85 new deaths reported today, and our 7-day average for that is 109. So I also really want to be cognizant that this Labor Day is coming up this weekend, and again, as I just shared, we've made some incredible progress together as a state over the last several weeks and months, and we do not want to lose ground in that progress. So it is not the time to let up our guard. It's time to stay vigilant. And one of the things we really want to make sure we continue to communicate and share with all of you is that our masks are not only protecting each other, but they do protect you as well when you wear these masks. So there's more and more data evolving around this, and we are learning more and more that, again, not only does your mask protect you, my mask protects me, and we're all protecting each other as a community by wearing our masks together. So this is really the other thing we have to keep doing to keep making this progress. The other thing, again, knowing that we have a 3-day weekend coming, we know it's been hard to stay home. The safest thing for you to do is still to stay at home and stay with people you live with. But if you do choose to be with others, please keep it outside, maintain your physical distance, keep it small, make sure it's brief. The longer you're with others, the more risk there is for exposure to COVID-19. And again, make sure you are wearing your mask. And that is our Labor Day message. Thank you very much.
Thank you, Dr. Pond. Really emphasizing again the importance of wearing a mask and the compelling data that we continue to learn from across the globe and here at home across the states about the impact of having a mask on your face to protect not just the people around you, but yourselves as well. So thank you, Dr. Pond, for emphasizing that and just recognizing that new piece of the message, right? We've been talking so long that it protects others, that it's a civic duty, you support your community, but more and more emphasizing the role that we have in protecting ourselves so we're there and not sick for our families and our communities, I think is another key piece of that message. Before getting into the blueprint for a safer economy, I wanted to talk a little bit about last week on Wednesday. The governor announced a large move with testing in the state, working with a long partner, Perkin-Elmer, to set up a large lab here in California that can manage up to 150,000 per day of those classic sort of gold standard PCR tests as we watch the continued evolution in the testing world of different types of tests, more rapid tests happening, other modalities, pooled testing, these different tools that we believe will keep us informed about transmission and also help support this blueprint for a safer economy and increasing operations of our business sectors. But along with that large number of tests happening in the state, we committed to you a few weeks back as we worked through some of the state's data system challenges and getting our data backlogs right, that we would be creating a new standalone COVID data reporting system. And especially as we think about this increased number of tests that the state will see in the months to come, having a robust system is key. So later today, we'll be announcing a contract with Optum Insight, a vendor, to create this new data repository for COVID-19 information so that it can be robust, strong enough, and give us the information that we know we need to manage the pandemic moving forward. That contract's executed now. We hope that in the month of October, it's stood up and ready to go, just as we will be with towards the end of October as well with our work with PerkinElmer and just our increased testing strategies across the state. So together, these two things helping support our ability to track transmission and support our communities with valuable information on how to crush the pandemic further. I want to spend a little time just reviewing the blueprint for a safer economy. I know it was a lot to take in on Friday. I think in our view, we've created what should be a simpler, more straightforward approach to understanding where a county is in its sort of march towards beating COVID and meeting different data thresholds, and where those business sectors in our communities can expect to operate. I'll remind you that we used to work under the confines of what was the county data monitoring list, many more metrics than we have now in the new framework that allowed counties in many ways to have across California 58 different flavors of what it meant to move forward and have our economy begin to operate. What we moved to in the announcement Friday is a framework which went live on Monday, which created 4 different flavors, 4 tiers, purple being the most stringent, or red, then orange, then yellow, all based on how a county is performing in 2 key metrics that you're accustomed to. One is test positivity over a 7-day average, as well as daily case rate over a 7-day average. That case rate number, we're moving to a daily number as opposed to a 14-day average number, in part because that's what much of the rest of the nation and the globe uses as well. So we wanted to stick to metrics that are nationally tracked and validated. So each county on every Tuesday will be looking at the data and how counties are performing in those 2 metrics, and then assigning a county a different color or tier assignment. I'll remind you that with each tier comes a different level of operations for many different sectors. Some might still remain closed in the tier that your county's in. Others may be fully open. There may be percentage based on occupancy. So some industries might start at 10% open in red and then move up as a county moves into orange to 25% operations. So all of this is trackable on the covid19.ca.gov website in an easy way to look, not just county by county, but industry by industry in each of those counties. I'll remind you that this is the state's framework, that counties may decide to be more restrictive than the state in certain areas because of issues or different conditions in the county that they know best. I will just remind you also that we're requiring any county to remain in a tier for at least 3 weeks. And then before they're able to move to the next tier, the next least restrictive tier, they need to meet that next tier's data thresholds for 2 consecutive weeks. So that really is sort of demonstrative of our whole goal of being slow and stringent. So we bring transmission rates as low as we can, ensure that as we bring back more sectors in the economy, allow them to have more of their operations back, that we have done what we can to really decrease the transmission, especially as we're knocking on the door of flu season. We're seeing some of the weather changes that we anticipate in the fall, where doing things outdoors isn't as easy as it were before. So really still emphasizing keeping things outdoors, keeping things small, all of those very important messages that we've been sharing, applying those to our different economic sectors so we can really get through the fall and winter with a great deal of success and avoid moving back. Speaking of moving back, we also laid out clear guidelines for how a county who maybe not only doesn't meet the next tier downs threshold, but is having a hard time holding on to the current tier that they're in, and they may miss those metric thresholds as well. And if we see that happening for 2 consecutive weeks, that will lead us into a dialogue with the county public health leaders, other civic leaders there as well, to determine how we make sure we don't see big surges in case numbers, we don't overwhelm the local hospital systems, and if it's required, to move back a tier to make sure that we do all we can to control it. Before opening it up to questions, I wanted to just emphasize schools. Both Dr. Pan and I are pediatricians. We care deeply about getting kids back to schools, but maintain a deep concern at making sure that there are safe environments for all staff and students, teachers, other personnel at schools. So ensuring that we've created a pathway, as we committed to on July 19th when we put out our school guidance, that 2 things still maintain. That even though we've moved to a new framework, we're allowing counties that met the 14-day threshold before we put this new framework into place, where they were off of the county data monitoring list, our old framework, for 14 days, to continue moving forward with their school reopenings if the labor agreements were all in place in that county and they had plans in place to do that. For counties that didn't quite meet that threshold, but move into the red tier from the purple tier, once they're in the red tier, they have to wait those 14 days, those 2 weeks before schools can move forward and begin plans for reopening, if that is the will of the county in a way. The waiver for the K through 6 opportunity that we talked about back in late July with schools, that still maintains. So counties in the purple tier who have essentially a case rate, a daily case rate of between 7 and 14, which equals the 100 per 100,000 for 14 days or 200 per 100,000 for 14 days of the county data monitoring frame, that 7 to 14 range also can apply if it is the agreement among the public health team in a county, the district leadership, schools, and parents and other stakeholders to move forward with that waiver application, that can also be applied for at the state level. So really, as it relates to school, did all that we can to maintain the same set of conditions and construct that we had under county data monitoring, because we know such tremendous work has been put in place to create plans to potentially bring some students in counties back to in-person learning. So before we wrap up and move on to questions, I just wanted to pick up on what Dr. Pan mentioned. As we move forward into another holiday weekend and we look back at the summer and we see some of the critical moments that we had as a state to really maintain and reduce transmission, I think about Labor Day and I think about our lifting up our laborers across the state and people who are part of our essential workforce and our workforce in general. And what more can we do to celebrate work, but to make sure that workers are protected? And wearing that mask, making sure that as we gather potentially with some people outside of our household, that we really do all of the things that Dr. Pan reminded us of, to keep it small and keep it outside. So wear your mask, the physical distance of 6 feet, the washing your hands, and being cognizant as we enter the fall and winter and many of the common viruses that cause the common cold start to come alive a bit more, that if you have symptoms that look like the common cold, often those are the same ones that we see with COVID. Please stay home. Please make sure that you're keeping your distance from those who aren't sick, that you haven't been around, so we reduce transmission and we don't see the surges that we saw over the summer in cases. Our standard reminder, we appreciate all 40 million Californians really working together to keep our transmission numbers coming down, to protect our hospitals as we prepare for the fall and winter. And so with that, I'll turn it over and take any questions that reporters have.
Bill Willen, the Los Angeles Times.
Hi, Doctor. I hope you're doing well.
Thanks, Bill.
I just wanted to get some details. What is the scientific basis for the new metrics for the reopening of counties? I mean, for instance, why must they hit the numbers for 2 weeks and not 1 week or 3 weeks? Why 4 to 7 new cases per 100,000 to be in the red tier and not 5 to 7 or 3 to 7? Why positivity rates and not hospitalizations? Is that based on a model that you saw or the state has seen in another country or state? Or is it based on scientific studies? Or did you create this from scratch?
Yeah, Phil, we've been looking across the nation, across the globe, frankly, at countries that have been successful with curtailing transmission, states that have themselves done their own reopening plans, and looked at a number of national leaders who are talking about which metrics give us the best sense early enough that they're not the most lagging indicators. So you asked about hospitalizations. We know that our hospital numbers have been strong and accurate, but they are somewhat lagging indicators. And so we wanted to identify metrics that I think have some national traction, that people understand, that we can measure reliably, and to try to keep it simple. We chose just 2 that are early to medium indicators of what disease transmission looks like. We also built these around things that aren't necessarily some of the earliest indicators, but incorporate those. It incorporates aspects of the ability to do your disease investigation and contact tracing and supportive isolation. It incorporates within these 2 metrics details around testing and testing capacity within a county. So we thought that these 2, and it wasn't just what we thought, we tested them with many county local health leaders, as well as national leaders, to really validate this approach. The ranges that we selected were based also on a bit of what we've learned from the past, working with other state leaders as well. And we wanted to create a setting where that we allowed improvement within the range before moving on to the next tier. Also, we believe that one of the lessons we learned in our earlier reopening experience was that 2 weeks wasn't enough. That it took at least 2 weeks, one sort of complete incubation cycle, plus a little bit more time to see the impact of any change that you made. And so we really wanted to stick to 3 weeks, and frankly, that's the minimum. We think that some counties may spend even longer in a tier as we see the impact of some of the changes that they make. And the 2 weeks of consecutive data to meet the next tier threshold, the next less restrictive tier, was there to make sure that we had consistent data over a period of time of at least 2 reporting periods. Remember, we're going to be tracking this data and reporting it every Tuesday. So we wanted 2 consecutive Tuesdays looking over a 14-day period to ensure that the county really did stabilize metrics to meet the next year. So again, all of these concepts and approaches emanate from this notion of slow and stringent is really going to carry us forward so we don't end up having to move back later.
David Baker, Bloomberg News.
Yes, I want to go back to the outbreak that we starting, I think probably about a month ago in the Central Valley. I wanted to see if you folks had any clear idea as to the source or sources of that outbreak, and if you could sort of bring us up to date on how things are going in the Valley now. And then sort of connected with that, not to be terribly pessimistic, but are we going to be in a situation in the months ahead where we have outbreaks getting under control in places like LA County, only to pop up elsewhere in the state and just constantly have to play whack-a-mole with it?
Yeah, I mean, both good questions. We plan to share a little bit more about Central Valley in the week to come, so I'll be brief here to answer your question. We have seen a number of outbreaks in some of our essential workplaces, large factories, large farms, really working with our community partners and public health partners, discovering that really the penetration of the messaging in Spanish and in other languages spoken in the Central Valley needed to be increased so that we could get the message around masking. I mean, it's great to be able to share the evolving evidence around masking and physical distancing in English with many of you, but then being able to share that locally in Spanish in the Central Valley is also key. We also have learned that despite efforts to really increase our reporting of race and ethnicity around COVID-19 data, testing, cases, hospitalizations, that we still nearly see 30% of our cases without that information. You speak to some of the Central Valley health officers and leaders, we learned that those cases that don't have the race and ethnicity data on the case actually have Latino surnames. So really focusing not just on the Central Valley as a geography, but really working with our Latino communities to increase our messaging, make sure that things like cloth face coverings are available to people working out on the farms and in the fields where it gets hot and it's not always comfortable to wear an N95 mask or a surgical mask. So really creating some efforts with the communities in the Central Valley to address where we believe the outbreaks were occurring and to really address those opportunities to not just reduce transmission now, but to really set us up for a future where we'll see reduced transmission moving forward. The second part of the strategy in the Central Valley, which has been successful just as it was with Imperial Valley, was working to increase the capacity within the hospitals, making sure that staffing was robust, that we had testing for staffing so that they didn't need to be out of the hospital settings or the clinic settings longer than necessary, and to ensure that we had not just testing, but other important supplies and space to be able to manage the number of patients. And we've done that now, both in Imperial Valley or Imperial County, in parts of the Central Valley, and really have built that up moving forward as a key part of our response. As you mentioned, yes, I mean, California's counties have different experiences with COVID. In one area, you'd seen a surge 2 months ago and now some reduction in cases. And then in other counties, you see some increases. We are continuing to learn how to address this broad geography and the response around COVID-19, working with our local partners to address those. And I'm sure we'll have some counties that experience increased transmission in the months to come. We feel better equipped than earlier in the summer and certainly the spring to address those. So even though we're going to see some occasional increase in transmission, we feel working with our local partners that we can curtail that and really be prepared as we have been in the healthcare delivery system to serve anyone who becomes sick enough to need that level of care.
Paul Sisson, the San Diego Union Tribune.
Thanks for taking my call. I had a couple questions for you here. They're kind of small details. First off, where and when will the state post its metrics update, which I believe is coming today, as today is Tuesday? Second, there has been some confusion down here in San Diego about the 50% capacity requirements for retail and grocery stores. We've seen some enforcing those capacity limits and others not. Can the state confirm that those are truly in effect at this point? And third, there's been some criticism about the least restrictive tier of the 4 tiers that were announced earlier this week. That would be tier 1, which calls for 1 case per 100,000 per day to be in that tier. Some have said that this is a level that's so low that just the false positive rates of the PCR tests that are being used would be enough to make it impossible to actually achieve that tier. So those are my questions.
Yeah, sure. So first, in the governor's presentation on Friday, we announced that we will be updating the metrics every Tuesday. We announced that the next update will actually happen next Tuesday, the 8th of September. So we went from Friday and the announcement, implementing Monday, and then waiting 8 days, so till the next Tuesday, the 8th. So a week from today, when we will update those tiers. So there's no new tiering update today. We've been working with all the counties over the weekend who had questions on how they were assigned to that tier, making sure that the data was accurate, had some adjustments that were made, and now anticipate moving forward next Tuesday announcing new tiers. With regards to the retail sectors, indeed, grocery stores continue to have a 50% occupancy requirement in the purple tier, and the rest of retail is at 25%, and that includes retail in malls. So that is the allowance within the purple tier. Of course, enforcement in all of these areas requires local partnership, working together with our business sectors. So I think that those issues are enforceable, and we hope that as we work with the business community and frankly all of you citizens as patrons, that we watch out and we make sure that those are adhered to, so we can continue to move forward without risking increased transmissions. As far as the metric cutoffs, we do know that getting to the least restrictive tier requires quite a bit of reduction in transmission. We believe that it is not impossible. In fact, we have some counties that have had very low, if almost no transmission, initially start in that yellow tier. For large counties, these are going to be challenges, but at the same time, they indicate a level of transmission where a lot of the sectors can operate at a high level of occupancy without the fear that we're going to have an outbreak or a major source of transmission. So we've worked hard to make these tiers have large ranges, and at the top tier and the lowest tier, or the most restrictive and the least restrictive tier, indeed they have some stringent requirements that we want to see in order to advance forward our state with our strong public health and economic health in mind.
Fiona Keller, the Mercury News.
Hi, Dr. Ghaly. So here in the Bay Area, some local officials are closing down beaches in anticipation of Labor Day crowds. But epidemiologists are obviously worried about larger threats indoors with family and friend gatherings, and have said that they're concerned that shutting down public spaces could cause people to gather inside. So I'm wondering if you could talk a little bit about the extent to which it's useful to kind of do a blanket closure of public spaces like beaches at this point, as opposed to, say, focusing the message more on indoor gatherings. Thanks.
Yeah, I think two things come to mind. First, thank you for the question. It's always great to have an opportunity to reiterate what I think is one of the top line messages for the day, which is let's plan for a safe and low transmission Labor Day. I think we had Memorial Day, we had the 4th of July. This is the third sort of summer holiday that we really want to do a great job on as a state. So beaches, other outdoor spaces, I think local conditions are going to drive what happens in some of those counties and in those outdoor spaces particularly. I don't want to speak to what is going into every county's determination as to what outdoor spaces are restricted or altogether closed, but I will endorse the point that you've made, which is we have so much good information about how ventilation and the outdoor space reduces transmission, that we encourage people to have small experiences that are short and outside, that if the decision because of a beach closure is to bring a small gathering indoors, we know that that is going to create a more risky environment for transmission, and would encourage people as much as possible to take it outside, keep it brief, and always wear your mask during those experiences. So both want to acknowledge that local conditions drive decisions around these specific closures, and maybe there's something that I don't have at my disposal that's driving that decision, but certainly being outdoors is a lower risk environment than being inside, not just this weekend, but on any weekend and for any different gathering.
Claudia Peschueta, KNX Radio.
Hi, I have a couple of questions. The first is the governor talked about being more stubborn on coronavirus reopening requirements now. Do you think it was a mistake for the state to ignore the earlier standards and proceed with reopening, especially given the surge that we saw in July? The second question is regarding homeless people. LA County has seen a big jump in homeless deaths. San Francisco reportedly has as well. Are you concerned about this? I'm wondering if the state is looking into it or taking any action. And do you think all homeless people who die should be tested for COVID? Thank you.
Yeah, a few questions. I'll try to answer them as well as I can. Regarding your first, and the governor uses the word stubborn. I use the word stringent. I think it's really a commitment to being patient with how we move forward here. And we learned a lot in the months of April, May, June, and July. We learned that it's a lot about how you do things and not just when you do things. And the how was being patient, having enough time between changes to allow us to see the impact of those changes actually manifest in the data, whether it's cases or hospitalizations, and making sure that with this framework, look at not just open and close as two different things, but degrees of opening, that having 10% operations is different than 25 or 50. And that as transmission comes down, that we have an opportunity to introduce those changes in a gradual way after seeing the impact of the first change before adopting the next one. So in many ways, I think the strategy and the framework that we put out on Friday really builds upon what was going on at the late spring and early summer with opening. But I can't emphasize enough that guidelines are guidelines. Tiering is tiering, but it requires all of us to do our part. And that's why we focus on Labor Day a bit. This is an opportunity for us either to together lose some of the gains that we've made, or together really reinforce those gains by doing some of the things. So whether it's you're going into an indoor restaurant with 25% occupancy because you're in the red, you're in a county in the red tier, wear your mask. You know, sit at a table far enough away from others that you don't know and don't interact with. Do the courteous thing and put your mask on when your server comes to the table. Support each other by really choosing a different how than we did in the earlier parts of our response. And I think that's going to take us a long way. With regards to homeless individuals as it relates to COVID, absolutely. We've been concerned early on. I think back to the first days of our response and really thinking about vulnerable populations in a way that I think was really the way California thinks about a lot of our vulnerable populations, protecting seniors, older Californians, those with underlying conditions, and those who are homeless or housing insecure, where it becomes really hard to do normal activities and not reduce your risk around COVID. So I think as a state, the response with Project Room Key and now Home Key, and the real focus on moving individuals indoors who maybe were encampments or sleeping on the streets, and supporting shelters to create some semblance of physical distancing to protect the most vulnerable has really supported, but we have not totally escaped some of the worst outcomes with our homeless residents and those experiencing homelessness across the state. So really trying to understand those who are sick, making sure that testing is not just available, but that we have quick turnaround so we can act, and doing the contact tracing among our residents experiencing homelessness. All key strategies that I know many counties are doing a tremendous job on. And we will continue not just asking questions of should we test every individual who's passed away, who's homeless for COVID, but also trying to be more upstream with our interventions and supporting people to get off the streets if possible into permanent supportive housing if it's available, and making sure all the wraparound services to reduce COVID transmission are available to those who are most vulnerable, including those facing homelessness across the state.
Catherine Ho, San Francisco Chronicle.
Hi, Dr. Ghaly. I have a few related questions about the new COVID data reporting system. Is that going to replace CalReady, or is it just going to break off COVID from the rest of the infectious diseases reported to CalReady? Is that the same Optum that's doing the test specimen collection? And lastly, what steps are you taking to make sure that the new system doesn't have the same problem with COVID that the CalReady system had? Thank you.
Yeah, all excellent questions. Thank you for asking them. So first off, Optum Insight is not Optum Serve. Optum Serve is our partner doing some of the statewide testing or collection sites across the state. Optum Insight is a separate organization company that we have contracted for this standalone COVID reporting system that will run parallel to CalReady. It will, yes, offload CalReady from all of the COVID-related data. I'll remind you that hundreds, maybe a couple thousands of tests a day feed into CalReady before COVID. Now we've put a workload on CalReady that was never imagined. This system is built to really handle that high volume of test results, both negatives and positives. It also gives us a chance to be more robust. I'm really pleased that we have with PerkinElmer testing or lab that will allow us to collect more and richer information and feed that into the new COVID data reporting system. So hopefully we close some of the information gaps that we have on demographic information, sexual orientation, gender identity push, all of this information, whether somebody is working in a healthcare environment, a different essential workplace. So really enhancing the state's ability to not just see where transmission is happening, but to understand some of the more detailed, nuanced pieces there. I think those were the primary questions you asked. If I missed one, please let us know later and we'll try to answer that as well.
Spencer Custodio, the voice of OC.
Hi, Dr. Ghaly. Thanks for taking our questions. Mine specifically about Orange County. Under the new tiered system, it looks like the county is doing better than what's showing, or doing better than the tier it's on. It's below the two key metrics, the tests or the number of positive people per 100,000 and the positivity rate. So it's 5.6 per 100,000 and a 5% positivity rate according to the state dashboard monitoring this. My question is, how did Orange County get on the purple list? And, in the upcoming assessment next week on Tuesday, is there any chance it could move off, or will it have to stay there for a couple more weeks?
Great question, thank you. It allows me to illustrate how the tiering worked this first time. And the first sort of assignment really looked back at 2 weeks prior to our announcement. So we looked back at the data the week of the August 11th to the 7th through the 17th, and then the week of the 18th as well, and looking at both of those weeks and determining how each county would be assigned to a tier using that data. And in the case of some counties, they met the criteria for one tier in the first week and then a different tier in the second. And following the whole concept of meeting the criteria for 2 consecutive weeks to move to the next tier, in the case of Orange and some other counties, they met purple in the first week, orange in the second, so they were ultimately initially assigned purple. But to your second part of your question, indeed, in the next time we run the data next Tuesday, if a county that has met the requirement to move tiers of the next tier for 1 week, they indeed, if they meet it again, they would then move into the red tier in this case. So yes, the next week, I think some counties will be wondering whether they are meeting it for the first time, the second time, or in the case that we've seen increased transmission in a county, they may miss the mark after meeting it once and therefore stay in the purple tier. So yes, indeed, there is opportunities as soon as next week for some counties to move from purple to red. Any county in the red will remain, any county in red, orange, or yellow. Well, yellow, they'll stay there. Hopefully continue the gains that they have and not see increased transmission. But in red or orange, they will stay for at least 3 weeks, as I described earlier.
Final question, Ashley Zavala, Cron 4.
Hi, Dr. Ghaly. I just have a quick question. I know I saw that today the administration was supposed to release health equity benchmark for counties in addition to daily case rate and test positivity rates. Is that still the plan? Were you going to do that? Was the governor going to do that?
So Ashley, thank you for the question. Our intent is to get a health equity measure, and just remind people that we chose 2 really what we think are tried and true metrics around epidemiology in test positivity and in the daily case rate. Because California is focused on equity, because so many of our disproportionately impacted populations work in many of the business sectors that are beginning to see increased numbers of patrons come, and thereby increasing potential exposure risk for those essential workers that have been disproportionately impacted. It has been an important part of our entire framework to focus on equity. Adding an equity measure is our intention. We had hoped that we would have it solidified for today and that I could share it with you. We aren't quite there yet. We want to make sure that we get good input from not just our state and county partners, but also from many community partners who have been working with us all along on decreasing disparities and focusing on equity. I will say that we have looked nationally and internationally at potential equity concepts, and there aren't very many that are really anchored around data and moving towards closing disparities. There's plenty of states that, like us, really declare the interest in focusing on equity, but I think we'll be certainly one of the first states to really put down a measure around how counties are doing on focusing on equity, whether that comes in the form of focusing on testing and contact tracing and isolation, or one of the other metrics. So stay tuned. We want to make sure that we have it be really up to the task here in California. So just a little bit more time before we're able to announce that measure. So with that, I just want to thank you all for tuning in. I know there's a lot of questions on the framework. We hope to continue answering them, working with your local leaders and your counties to make sure there's no questions, that the path forward is as clear as it can be, and that we are slow and stringent as we move forward, so we make sure that we keep the improvement going, and that we don't, through the fall and winter, when we see flu, when we see some of the potential increased transmission because of wildfires and evacuations, that we've done all we can to protect Californians, and that we can get through this together and actually crush COVID-19 once and for all. Thank you.